Hello, my name is Asia Rains, and I am a student in your MPH 650, and this is my presentation on COVID-19 vaccinations, which is the vaccines that I selected for this presentation. So, what is COVID-19? The coronavirus disease is an infectious disease caused by severe acute respiratory syndrome coronavirus, a virus that in the coronavirus family, which emerged in China in late 2019, the SARS-CoV, which is the severe acute respiratory syndrome coronavirus, which causes the COVID-19, is part of a large family of coronaviruses that are named for the crown of spikes on the virus particles' spherical surface, which helps the virus attach to cells and infect them. The coronavirus are found in humans and in other animal species, including bats, cats, livestock. Some coronaviruses are found in animals. It can involve and infect people. Most people infected with the virus will experience mild to moderate respiratory illness and recover without treatment. Some, however, can be severely ill and require medical attention. Other people, it can bring conditions like cardiovascular diseases, or it can affect those who have already had those conditions more severely, which can cause even death, unfortunately. All right, so COVID in the United States. The coronavirus outbreak profoundly impacted the American culture, making it an unprecedented chapter in our history. Originating in China in the late 2019, the virus uh, led to the World Health Organization to declare a global pandemic on March 2020. The initial response in the US was notably sluggish, particularly in terms of the healthcare preparedness, travel restrictions, and testing efforts. The first confirmed American deaths occurred in February 2020. COVID vaccines became available under the Emergency Use Authorization in December 2020, launching the National Vaccination Program, which the first vaccine receiving full approval from the FDA on August 23rd, 2021. State and local responses included wearing masks, quarantining, and school closures as well. And then here is just a chart that just displays age groups and people who actually tested positive for the COVID-19 virus. It also breaks down if they had particular things going on with them prior to, whether it be like cardiovascular diseases or any health conditions prior to that. Here's additional information regarding the COVID-19. This is just a table that shows like how you can be affected with it. So it is contracted by breath. So sneezing, coughing, breathing on someone, or talking. It is person to person. So drinking after someone, eating after someone, and things like that, you can get the virus. Also by touch. And then if you do have a weak immune system, you can have a severe case, as I discussed before with um, previous diseases like cardiovascular disease and things like that. Be you can catch the disease and it can be very severe. The virus and it can be very severe. So symptoms of COVID-19 is dry cough, shortness of breath, loss of taste or smell, extreme fatigue, and fevers and chills. And then preventative measures, what I'd said before, is social distancing, wearing a mask, quarantining, and of course, sanitizing. Symptoms of severe COVID-19 is chest pains, unable to sleep, pale skin, and trouble breathing. So, why are COVID 19's vaccinations important? So, vaccination against the coronavirus disease remains the most important measure for controlling the pandemic. Vaccines have also played an important role in the prevention of other diseases, and vaccination of children against certain diseases is required by law in most developed countries. Despite all of this, some people remain vaccine hesitant. In 2019, the WHO, which is the World Health Organization, um, listed vaccine hesitancy as one of the 10 threats to global health. The percentage of people worldwide who have been vaccinated with the COVID-19 is still not at 70% of the total population. The targeted coverage by mid 2022, well, this was the targeted coverage by mid 2022. And as of March 24th, 2022, a total of 57% of the people were fully vaccinated globally, with figures in Europe and Croatia with 62% in Croatia, sorry, and with 62% and 55% respectively. So why are individuals hesitant? So many individuals are hesitant of getting the vaccine due to lack of trust in institutions or their medical providers. Also, the idea that they could get the virus and be severely infected even after being vaccinated. Another reason why people may be hesitant as well is just by not being exposed to it, not knowing about it, and things like that. So, and also um, just like personal opinions or personal ideas, whether it be religious related, or things that go on around them in their environment. So, vaccination resistance. So, as I discussed before, there are common reasons why individuals shy away from getting vaccinations. These reasons vary, but they can be encompassed in four overarching categories. These categories are religious reasons, personal belief, safety concerns, a desire for more information from healthcare providers. But specifically related to the COVID-19, the two that stood out more frequently was lack of trust from medical providers, and personal beliefs, whether it be not being exposed to COVID-19 as much, so you feel a certain way about it, or whether it be like religious related as well. It says from August till December, there were in 2021, there was a study that showed it took a study of 721 individuals. 465 of those were vaccinated and 256 of them were unvaccinated. And then they were asked, why they decided not to be vaccinated, and most of their answers were related to not having trust in their medical provider and personal beliefs. All right, so here is one of the um, biological mechanisms of the coronavirus vaccination. So the mRNA is currently a type of COVID-19 vaccination that is used in the United States. To trigger an immune response, many vaccines put a weakened or inactive germ into our bodies. The mRNA vaccine uses mRNA created in the laboratory to teach our cells how to make a protein or even just a piece of a protein that triggers the immune system response inside of our bodies. This immune system response produces antibodies and what helps protect us from getting sick, from the germs in the future. The mRNA will enter the muscle cells. Once inside, they will use the cell's machinery to produce harmless pieces of what is called spike protein. The spike protein is found on the surface of the virus that causes the COVID-19. And then after the protein piece is made, our cells break down the mRNA and remove it. Leaving the body as waste, our cells display the spike protein piece on their surface. Our immune system recognizes that protein does not belong there. This triggers our immune system to produce antibodies and activate other immune cells to fight off what it thinks is an infection. So this is just like an overall explanation of how the mRNA works, which is a vaccine. And basically, it is put into our bodies, and our body reacts by noticing that there's something that is not normal in our bodies, and it triggers it, and it immediately fights it off. And then, so the cost of the vaccine. So the mRNA, as I discussed before, is a more common type of vaccine. And the US requested an annual production capacity of 100 million doses of the mRNA vaccine, which could be, excuse me, established in an existing injectable medicine production facility with minimal additional manufacturing footprint. The estimated total cost need for starting the mRNA vaccine manufacturing in such facilities producing 100 million doses for the US is $127.1 million. For the BNT162b2 vaccine, and then $270 million for the mRNA 1273 vaccine. And with this budget, it includes facility related requirements, consumables, equipment, material, labors, and other resources for drug substance production and fill and finish requirements for this vaccine. And this just kind of shows a overview of what the process looks like in creating the mRNA vaccine. Yep. All right. So here is an additional vaccine that was created as well. The protein subunit vaccine is another vaccine that is used for the coronavirus. The protein subunit vaccine contains pieces or proteins of the virus that causes COVID-19. These virus pieces are the spike protein. The vaccine also contains another ingredient called the adjuvant that helps the immune system respond to the spike protein in the future. Once the immune system knows how to respond to the spike protein, the immune system will be able to respond quickly to the actual spike protein and protect against COVID-19. And basically, the protein sub subunit, COVID-19 vaccines are given in the upper arm muscle after the vaccination. Nearby cells pick up these proteins, and then next, our immune system recognizes that these proteins do not belong there. And another ingredient in the vaccine, the adjuvant helps our immune system to produce antibodies and activate other immune cells to fight off what it thinks is an infection. So similar to the mRNA vaccine, where our body is noticing something that is abnormal and it triggers it to fight off this infection. So what is herd immunity? According to the text in our books, herd immunity is a widespread immunity in a population to a specific pathogen, sequestering the pathogen so it cannot spread rapidly. If at all, substantial herd immunity usually requires at least 85% coverage of a vaccine in a population. So two ways you can achieve herd immunity. If majority of the population has been exposed to the virus, which means their bodies have been immune, and two, if majority of the population has been vaccinated. Another definition of herd community or community herd immunity or community immunity is when a large part of the population of an area is immune to a specific disease. If enough people are resistant to the cause of the disease, such as a virus or bacteria, it has nowhere to go. So the main obstacle to the herd immunity when COVID began spreading in 2019 was the virus that causes the disease was novel or new. So that means nobody knew about it, nobody had been immune to it or exposed to it before, and it had never been in a population ever. So that means that there was no existing immunity to build on. So there are now vaccines for the COVID-19 that have been given in more than 13 billion doses, and more than 770 million people have been infected worldwide. but we haven't reached herd immunity with COVID yet. Reasons that reasons for this threshold is difficult. Reasons why it is difficult to meet this threshold is lack of vaccines, and there are new strands that are arising. So, in conclusion, research shows that the COVID-19 vaccine has undergone extensive analysis and testing to confirm its effectiveness as a preventative measure. The pandemic caught many people off guard as the virus was unfamiliar to most. The US response was slow, largely due to uncertainty about the virus severity, which had a profound impact on many lives. This situation fostered distrust in the medical providers and led to the formation of personal opinions about the virus and the vaccine. Initially, vaccines were released under emergency use authorization without the full FDA approval, which were raising concerns as well. The pandemic served as a critical learning experience for all of us. So, moving forward, my hope is that the WHO, the FDA, and the US will be better prepared if something similar or this similar crisis happened in the future. And here are the references that I used to formulate this presentation. Thank you so much for your time, and I hope you enjoyed this presentation. Thank you.